Let's go. So the abdominal aorta has paired branches that go to the retroperitoneal organs and unpaired branches of arteries that go to the intraperitoneal organs. The most superior of these is the celiac trunk, and as you can see, it has branches to the liver, the gallbladder, upper part of the duodenum, pancreas, stomach, and spleen. This is the foregut. Next, we have the superior mesenteric artery, which supplies the midgut, going to the lower part of the duodenum, the jejunum, ileum, ascending colon, as well as the transverse colon. Next, the inferior mesenteric, which is the hindgut, goes to the descending colon, the sigmoid colon, and the rectum. Now for the paired vessels, we have the inferior phrenic, which supplies part of the adrenal glands. We have the suprarenal, leading to the adrenal glands, renal, going to the kidneys, gonadal, going to the testes or ovaries, the lumbar, which goes to the abdominal wall, skin, vertebrae, and meninges of the spinal cord, as well as the median sacral, which supplies the sacrum, coccyx, and vertebrae of L4 and L5. Now it's of note that all of these veins of the system drain into the inferior vena cava and return to the heart, with the exception of the left gonadal that first drains into the left renal vein. Now all the paired veins drain into the caval system, which you can see in blue on the picture, into the inferior vena cava and then head back to the heart. And the purple is the portal venous system. So this is comprised of the superior mesenteric, inferior mesenteric, and splenic veins. Now these are unique because they return to the liver, pass through two sets of veins without going into an artery in between, and then returning out to the inferior vena cava and back up to the heart. These two systems anastomose in three different locations of the body, meaning that they join together to allow blood flow to go back to the heart even if it is obstructed in one direction. Normally what happens is the portal vein dumps large amounts of blood into the caval system, causing bleeding and swelling. Now the three locations that this can happen include the rectum, where internal hemorrhoids can happen, the esophagus, where esophageal varices can happen, and the umbilicus, where caput medusa can happen. Now talking about the lymph of the abdomen, there are pre-aortic nodes, which come from the celiac, superior mesenteric, and inferior mesenteric areas. Then we have the para-aortic nodes, which come from the abdominal wall, the kidneys, the ureters, the suprarenal glands, the uterus, the testes, and the ovaries. Now these all join together in the cisterna chyli, head up to the thoracic duct, and then to the left venous angle. Thanks.